Imagine this for a second. A medical framework that completely, seamlessly links your darkest anxieties directly to your physical heartbeat, your digestion, and just your overall physical health. Sounds pretty modern, right? Well, imagine that this framework wasn't developed in some cutting-edge 21st century research lab. It was actually pieced together in Central Asia, literally almost 1,000 years ago. Welcome to today's Explainer, where we're going to focus on a true titan of history, Abu Ali al-Hussein ibn Abdal ibn Sina. We're going to explore exactly how his 11th century medical insights completely solved the mind-body split centuries, and I mean centuries, before modern medicine even realized it was a problem.
Okay, let's dive into this. We've got a packed, totally fascinating roadmap ahead of us. First, we'll meet the scholar of Afshana, then we'll map out the internal senses, check out an unbelievable real-world case of psychosomatics and pulse tracking, explore his mental illness classifications, and wrap up with his enduring mind-body legacy.
So, Section 1, the scholar of Afshana. Let's meet the genius behind the medicine. Born around 980 CE near Bukhara, which is in modern-day Uzbekistan, Ibn Sina is often known in the West as Avicenna. And the guy was an absolute powerhouse. Over his lifetime in the 11th century, he wrote over 400 foundational works. That includes two absolute monuments of human knowledge, the Canon of Medicine and the Book of Healing. People often call him the father of early modern medicine, and for good reason. But I really want to draw your attention to a huge historical contrast here. It wasn't until the 19th century that European medicine officially separated the physical body from the mind. Think about that. Ibn Sina was operating nearly 8 centuries prior, and to him, there was absolutely no division between the two. The whole shebang was connected. And that brings us to a really crucial concept, ilm al-nafs, which translates to the science of the soul. Essentially, this was early Islamic psychology. Ibn Sina made massive, foundational contributions here. He wasn't just sitting in a room somewhere philosophizing about human nature. He was an active, boots-on-the-ground pioneer. He meticulously observed his patients, cataloged mental disorders, and adamantly insisted that psychological suffering was a very real, very physical medical condition, one that deserved rigorous, compassionate care. Just think about how revolutionary that perspective is for the year 1000. Moving to Section 2, mapping the internal senses. To really grasp his clinical practice, we first have to understand how he systematically mapped out the mind. Let's move to and see how this builds, because it's like a giant puzzle. Ibn Sina divided human perception into external senses, sight, sound, touch, and internal senses, which happen entirely inside the brain. He actually mapped out 5 distinct internal cognitive faculties. First up is common sense, or al-hiss al-mushtarak. This combines raw sensory input. So, for example, your brain recognizes a red apple as one single object. Second is representation, al-khayal. That's your ability to keep that image of the apple in your head after it's gone. Third is imagination, al-mutakhayla, where you mash up ideas to create totally new concepts. Fourth is estimation, al-wam, which is your ability to perceive invisible qualities like danger or safety. And fifth is memory, al-hafiza. That's the ultimate storage vault for all these experiences and their emotional weight. The biggest takeaway from this mapping is, honestly, profoundly modern. Perception is not passive. Your brain is actively interpreting reality and slapping heavy emotional weight onto your experiences. Ibn Sina used this brilliant analogy to explain it. He pointed out that a sheep instinctively feels fear the second it sees a wolf, even if that specific wolf hasn't done anything aggressive yet. The sheep's brain is actively perceiving intent and danger, using that faculty of estimation we just talked about, and it attaches a powerful, instantaneous, emotional, and physical response to it. All right, Section 3, psychosomatics and the pulse. Here is where the theory turns into absolutely astonishing empirical practice. So Ibn Sina basically pioneered the study of how psychological stress causes real physical illness. He documented how fear, grief, anger, and anxiety directly trigger physiological changes. But that raises a massive question. How do you diagnose a hidden illness when the body isn't showing any obvious physical disease? Well, there's this famous historical case that perfectly captures his genius. A young prince had fallen mysteriously ill. The guy was totally bedridden, completely emaciated, just wasting away. And yet none of the other doctors could find a single physical ailment to explain it. It was a total medical mystery. Then Ibn Sina steps in. But he didn't look for a physical pathogen. Instead, he simply took the young man's wrist and physically held his fingers against the prince's pulse. Then, slowly and methodically, Ibn Sina started reciting a list out loud. First, districts in the city. then specific streets, and finally, family names. He just sat there, tracking the rhythm of the blood beneath the skin, waiting. And suddenly, when one specific neighborhood and one specific family name were mentioned out loud, the prince's pulse violently and sharply spiked. And this brilliantly illustrates the sheer power of his method. Based on that physical reaction, Ibn Sina was able to diagnose the prince with al-ishq, severe emotional distress due to unexpressed love. Essentially, the prince was lovesick, but this wasn't some romantic poetry. This was a strict clinical medical diagnosis. By measuring how the heart rate responded to psychological triggers, Ibn Sina formed what was basically an incredibly early, masterful demonstration of physiological biofeedback. He proved unequivocally that the mind was profoundly affecting the body. Section 4. Classifying mental illness. Let's look at how he brought this incredible level of care to the wider public. Ibn Sina practiced within the Islamic Bimarstan system. These were hospitals that provided highly methodical, entirely free medical and mental health care. Now, what's really interesting here is how directly his 11th century classifications map right onto our 21st century psychiatric diagnoses. He categorized all of this systematically in the canon of medicine. Take melancholia, which he noted featured chronic sadness, fear, and sleep disturbances. That perfectly aligns with modern major depressive disorder or severe anxiety. Mania lines up with extreme hyperarousal and racing thoughts. He identified hallucinations, sensory perceptions without external stimuli, and linked them to cognitive breakdown. He even recognized nightmare disorders and insomnia as central nervous system issues caused by emotional strain. This is absolutely crucial, because right around this exact time in medieval Europe, mental illness was commonly being blamed on demonic possession or lack of faith. Ibn Sina entirely rejected that nonsense. Instead, he used this incredibly modern, integrative therapeutic approach. He prescribed dietary adjustments and physical exercise to correct biochemical imbalances in the body. He used hydrotherapy and warm baths to physically soothe the nervous system. He literally prescribed music therapy, tailored to alter a patient's emotional state. And, perhaps most impressively, he utilized cognitive reframing. This was essentially early talk therapy, used to help his patients process grief, loss, or trauma. Finally, Section 5, the Mind-Body Legacy. How does this 1,000-year-old framework actually hold up today? Honestly, when we put Ibn Sina's concepts side by side with modern science, the parallels are staggering. Modern psychiatry relies heavily on neuroimaging, neurotransmitter mapping, and controlled trials, right? But Ibn Sina arrived at remarkably similar clinical conclusions using pure observation and logical analysis. So the crucial point is this. His concept of WAM, that internal sense of estimation we talked about earlier, it perfectly anticipates the absolute core rule of modern cognitive therapy. Cognitive therapy teaches us that it's not the event itself that disturbs us, but our interpretation of the event. Ibn Sina understood that exact psychological mechanism a millennium ago. Which brings us to this incredibly powerful summary of his philosophy. To heal the body, you must listen to the soul, and to treat the mind, you must care for the physical body. Just think about the trajectory of modern medicine for a second. We spent so much of the 20th century dividing the body into isolated little specialties. You'd send a physical ailment to one doctor and psychological distress to an entirely different one. Today, contemporary medicine is actively scrambling to undo that division. We're seeing fields like integrative health, somatic psychology, and psychoneural immunology trying to put the pieces back together. But Ibn Sina? He solved that split over 1,000 years ago. Islamic civilization during the Golden Age treated the mentally ill with dignity, medical rigor, and profound compassion, at a time when much of the rest of the world just locked psychiatric patients away in the dark. By recognizing that perception is active, that our emotions have a very real physical pulse, and that the mind and body are fundamentally one single system, Ibn Sina left us a legacy that we're only just beginning to fully appreciate. Which leaves us with one final, totally fascinating question to consider as we wrap up this explainer. Is modern medicine finally catching up to the 11th century?